Proximal humerus. Published by WordPress.com. Mechanism of injury. Commonly caused by falls, electric shock, seizures, or high-impact trauma. Classification. Near classification. Divides fractures into 4 parts: humeral head, GT, LT, shaft. A part is considered displaced if 1 cm of displacement, 45 degrees of angulation. Types: 2-part, 3-part, 4-part, fracture dislocation, anterior, posterior. Clinical presentation, CP. Pain, swelling, limited range of motion, ROM. Axillary nerve injury, sensory loss over the deltoid, weak abduction. Imaging. X-rays, AP, lateral, axillary views. CT. For detailed fracture pattern assessment if intra-articular extension. MRI. To evaluate associated rotator cuff injuries. Proximal humerus. Published by WordPress.com. Management. 1. Conservative. Sling immobilization with early ROM, 2 weeks. Indicated for 1-part fractures or surgically unfit patients. 2. Operative. CRPP, closed reduction and percutaneous pinning. 2-part surgical neck fractures with good bone stock, intact calcar, minimal comminution. ORIF, open reduction and internal fixation. Indications: displaced GT fractures greater than 5 mm. 2, 3, or 4-part fractures in young patients. Proximal humerus and shaft humerus fractures. Techniques: plates and screws, inferomedial calcar screw to prevent varus collapse. GT fixation. Screws, non-absorbable sutures, or tension band wiring. IM rodding, for surgical neck fractures. And 3. Arthroplasty. Indications: anatomical neck fractures in elderly. 4-part fractures. Fracture dislocation with unstable fixation. Types: hemiarthroplasty, for intact glenoid. Total shoulder arthroplasty, TSA, for affected glenoid, arthritis, fracture. Reverse shoulder arthroplasty, for compromised rotator cuff, RC. Complications: avascular necrosis, AVN, common in anatomical neck, 3 and 4-part fractures. Risk of avascular necrosis. Hurdle criteria: metaphyseal extension of the humeral head less than 8 mm, medial hinge disruption of greater than 2 mm, and fracture through anatomical neck. The combination above factors had 97% positive predictive value for humeral head ischemia, myositis ossificans, adhesive capsulitis, non-union or malunion.